There have been many advances in the treatment of eye disease, from improvements in surgical techniques that incorporate lasers to the ability to transplant tissue in the eyes. Dr. Mark Barak at Pomona Valley Hospital Medical Center tells us about some of the newest procedures.
LASIK and laser treatment of refractive errors has changed quite a bit, and we're at the point now where we can fix any refractive problem that exists in the cornea. So we can treat nearsightedness, farsightedness, astigmatism, and in cataract surgery, we now have implants that allow a person after cataract surgery to be able to see far and near at the same time. These are called multifocal lens implants. When we take the cataract out, we always put an implant in, and the standard implant up till 5 years ago was monofocal. You had one focal point, and for everything else you needed glasses. But these days we can make it so a patient doesn't need glasses for anything. If cataracts get really bad, the patient will notice blurring, difficulty driving at night, difficulty reading. With cataracts, you lose general vision. Everything is blurry. But with macular degeneration, it's the central vision that is lost in the beginning. Both tend to be slow processes. Macular degeneration is a very common problem in people as they get older. Used to be we had no treatment for any type of macular degeneration. There are two types of macular degeneration. There's the slow, dry kind, and there's the aggressive, scarring, wet kind. The dry or wet refers to whether you have blood vessels growing into the retina that shouldn't be there, and they create a lot of damage in the eye. It used to be when we saw a patient with wet macular degeneration, we were helpless, and they would eventually go legally blind. For the past few years, we do have a good treatment for the wet, aggressive type of macular degeneration. We inject a medication into the eye, and it gets these bad blood vessels to shrink up and go away. With the slower, dry kind of macular degeneration, we don't have any great treatments yet, but there are several on the horizon that look very good. However, we have identified certain vitamins and minerals that slow down the process of dry macular degeneration. Glaucoma is often referred to as the thief in the night, because a patient who doesn't get a regular eye exam may not notice that they're losing vision from glaucoma. They may have no symptoms until they've lost most of their vision from glaucoma. So the patient may have no symptoms, may just go in for a routine eye exam, and they may be told, hey, you may have glaucoma. And then we do further testing to confirm the diagnosis.
Dr. Barak, how often should someone go in for an eye exam?
Everyone should have an eye checkup before the age of 60 every 2 or 3 years. 60 and above every year. And that's assuming you don't have any symptoms. If you do have symptoms of blurred vision or difficulty with your vision, obviously you should go in sooner.